Hi, my name is Victoria Deardoff, and this is my assessment for advanced assessment with Dr. KFC. This is my lovely patient, my husband, who has volunteered to help me with this. So we're going to get started. Hi.
Hello.
I'm going to go ahead and close that door, make sure we've got some privacy.
Okay.
Hello. I'm going to wash my hands real quick.
Okay.
Hi, I'm Victoria. I'm
Hi.
going to be the nurse performing our assessment today.
Mhm.
How are you?
Doing great.
Fabulous. And this is Luke.
This is Luke.
Good. Awesome. Okay, so Luke, I'm going to be doing an assessment on you. It's going to be a head-to-toe assessment.
Okay.
There's going to be lots of touch and feels and listening to different parts of your body.
Okay.
Okay. And really the purpose of this is just to see what you got going on.
Okay.
So if at any point you have any questions or concerns, you feel pain or uncomfortable, I want you to stop me and let me know, okay?
Okay, we'll do.
Wonderful. And before we really get started, I just want to make sure we're on the same page. So can you please tell me your name and your date of birth?
Luke Deardoff,
Okay, and your birthday?
June 7th, 1993.
Fantastic. And Luke, do you have any allergies to medications?
Nope.
No? Good. And then any allergies to food or the environment?
Nope.
Good job. Okay. And then are you experiencing any pain right now?
No.
No? And nothing in your head, in your belly?
Mm-mm.
Okay. Do you have any past medical history that I should know about? Something like a heart condition?
Nope.
Nothing? Good. Okay. And then are you experiencing any nausea or vomiting?
Nope.
Nothing like that?
Mm-mm.
Good. And then I have some psychosocial questions to ask you.
Mhm.
They seem kind of abrupt, but we're going to go ahead. Are you having any thoughts of hurting yourself?
Nope.
Okay. Any thoughts of killing yourself?
Nope.
No? Any thoughts of harming others?
Nope.
No? Good. Thank you for answering those questions. Are you feeling anxious at all?
Nope.
No? Any persistent feelings of hopelessness?
Nope.
Nothing like that? Any trouble sleeping?
Mm-mm.
Good. Okay. Well, let's go ahead and get started with the rest of this. So these questions can seem kind of silly, but they're important that I ask them just to see how your brain's doing. So what's your name?
Luke.
Great. And Luke, where are we right now?
We're in a clinic.
Yes, yes. And then what year is it?
2021.
Perfect. And then what are we doing today?
We are doing just a simple head-to-toe assessment.
Yes, thank you very much. Okay, and then I can tell that my patient is alert and he is cooperating with me. He's following commands and is answering questions appropriately. And so I'm going to go ahead and start with those touch and feels that we talked about on your head.
Okay.
And don't mind me just talking through everything that I'm feeling, okay?
Okay.
So I'm feeling the skull right now. It appears to be normal cephalic. The hair is thin, a dirty blonde. The texture is fine. And I'm not seeing any lesions, bumps, lumps, or signs of irritation or infestation. Okay, and so then we're going to test what's called the facial nerve. And so I want you to kind of do some silly facial expressions for me, okay? So can you lift up your eyebrows for me? Great. I want you to puff out your cheeks. Good job. And then go ahead and smile. Good. And then show off your teeth for me. Good job. Very good job. And then squeeze your eyes really, really tight. And last one, I want you to purse your lips like you're going to whistle. Good. Very good. Okay. And then I can feel that the skin is nice and warm. It is kind of a thin and smooth feeling on either side. I can also see that the face is symmetrical. Our nose is midline, kind of above the lips and chin. I have ears on either side that are symmetrical, and the eyes are the same size. And when Luke was doing those facial expressions, I wasn't seeing any signs of drooping or a tremor. Okay, and now we're going to test the hypoglossal nerve, so I want you to stick out your tongue for me and kind of wiggle it all around. Good job. That was excellent. And that nerve is intact. Okay, and so now we're going to be inspecting your eyes. So I just want you to kind of look straight at me, or actually, if you could just look at that cabinet behind me, okay? We're going to get some slight pressure, looking at the conjunctiva and the sclera. The same thing, okay? And so our eyes, we have a nice white sclera. The conjunctiva was clear of any drainage. I'm not seeing any signs of trauma or infection. And now we are going to be doing the what's called the 6 cardinal fields of gaze, and I'm going to be testing 3 cranial nerves with this one: your oculomotor, the trochlear, and the abducens. Okay. So what I want you to do is follow the edge of this pencil, that eraser. I don't want you to move your head, just your eyes. All right, here we go. Great job. Keep going. Okay. And it's coming towards your nose. Keep following, keep following, keep following. Perfect. And so during those gazes, I was looking for nystagmus, and Luke's vision, or not vision, but his eyes were able to track very evenly and rapidly with the pencil. I didn't see any indication of the nerves being damaged from an injury. And then now I'm going to be testing your pupils and how they are reactive to light. I'm not able to dim the lights in here, so I'm going to use this piece of paper to kind of create a little bit of a darker environment. Okay, let your pupils get nice and big. And this is a little bit of a brighter light, and it's just going to be coming in from the sides, okay? Great. Excellent. 2 more times. Wonderful. And so Luke's pupils were equal and round. They're probably about a 2, I'd say, 2 centimeters. And they are reactive to light. And when we moved in, they were accommodating. So his eyes are bilaterally perla. And I know that the oculomotor, trochlear, and abducens nerves are intact. Okay, so now I'm going to go ahead and look at your ears. We're not going to look inside, just on the external aspects, okay? And so I can see from just looking at Luke that our ears are symmetrical. They're evenly spaced on his head at the same height. The skin is nice and smooth and easily malleable with that cartilage. And all of the expected features are there. So I've got my targus and my pinna, and everything is looking good. Do you have any pain when I'm touching?
No. No,
and I'm not seeing any lesions or nodules or signs that I'd be concerned with an infection or trauma. Okay, and so now we're going to be inspecting the neck. So Luke, you're doing a great job just looking forward exactly like that.
Mm-hmm.
I can tell that my trachea is midline and feel that hyphoid bone, which is typical in males, or that Adam's apple. Go ahead and take a nice deep breath for me. And then out. Great. And then swallow. Perfect. And I can feel that move, and that's exactly what I want. Now I'm going to be kind of feeling the different lymph nodes. Do you have any pain when I'm doing this?
No.
No? Wonderful. And that skin is very smooth and warm to touch, and it's an even skin tone. There's a little bit of redness noted, but we're just pale humans, so no, nothing wrong with that. Okay. And so look, what I want you to do is I want you to take your chin and kind of look towards that door, just at a nice even, perfect. And so what I'm assessing for right now is if I can observe the jugular veins. Go ahead and do the other side for me. Great job. And so I actually can see this jugular vein if you just kind of relax right there. Yeah. And so I'm not observing much pulsation with that, which is good. They don't appear to be distended. And then on the back of his neck, I'm not seeing any distension. And this is a very positive sign, as jugular vein distension can be kind of an ominous sign of a cardiac emergency or severe hypertension. Okay, and so now we're going to be testing your accessory nerve. And so I want you to kind of shrug up for me against my hands. Excellent, excellent. Very strong muscles. That was good. Okay, so this next thing is a little silly. I want you to go ahead and close your eyes for me, and I just want you to tell me what you smell.
Alcohol.
That's correct. So this is an alcohol pad that we use to kind of clean. And so that olfactory nerve is intact. Okay. And so while we've been kind of talking, I've been observing you, and I can tell that our respirations are very even and unlabored. And I'm just going to take a moment and observe and just kind of listen or feel your heart rate, okay? Perfect. And while I was doing that, I could tell that Luke was breathing at a very even and comfortable rate of about 16. And so, Luke, are you feeling short of breath at all?
No.
No. Are you having a hard time catching your breath?
No.
Excellent. So now I'm going to go ahead and take a listen to all the different lobes of your chest. I just want you to breathe normally, and then if I ask you to, take a deeper breath, okay? Make sure this is nice and clean. All right, and if we were in the hospital setting, I would be doing this under his shirt, but you don't have to take your shirt off for me, Luke, for this video, okay? Excellent. All right, and then look, if you'll kind of shift your weight a little bit, I'm going to inspect your back, okay? Same thing, you were doing a great job. Okay, look, I'm going to listen to the lateral aspect of your lungs. So if you can go ahead and lift this arm for me. Great, you can relax. And let's do that same thing on the other side. Nope. Thank you very much, Luke. That was wonderful. Ew, excuse me. I know, my goodness. Okay. And so now, Luke, what we're going to test is called the posterior expansion. And so what I want you to do is actually, if you could sit in this chair real quick,
Okay.
just so we can kind of show off to the camera with your legs out that way. Or that works, actually. So I'm going to move you forward just a little bit. And so I'm placing my hands on your back, and I just want you to take a real deep breath for me. And out. Wonderful. And to show you on the anterior side what we did is I just put my thumbs and hands right here, and what I'm feeling is for that expansion of his chest. Go ahead, nice deep breath. And out. And so it was even on both sides at that midline point, very distinct, kind of indicating that both lobes were able to get adequate amounts of air. And while we're right here, looking at the contour of Luke's chest, you can see that's very typical for an adult male, where our width is kind of greater than our depth, and we've got a very gentle curvature on either side, nothing concave or kind of protruding. Excellent job, Luke. If you want to go ahead and take, actually lay down on the bed for me. we're going to be looking at your belly. All right. And while we're talking, oh, excuse me, I'm so sorry. We're going to be looking at your heart next.
Okay.
We're getting to your belly. And so I'm going to be listening to a couple different areas on your heart. We're going to do the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral, okay? Oh, that's a good point. You're laying in the bed so funny.
I know.
It's fine. All right. No, I had it the right way. Okay. So now I am listening to the aortic. Now the pulmonic. Got Erb's point. The tricuspid, and the mitral or the apical. And while I'm here, I'm going to go ahead and assess the rate. And so you can keep writing down for me. Luke had a very comfortable rate of about 54. I heard very distinct S1 and S2 with that love dove. And there weren't any splitting sounds, galloping, or murmurs, or friction rubs that I was hearing in between. Another thing that I could be assessing is doing my carotid and the apical pulse at the same time to kind of make sure that they were congruent if I was unsure of any of my findings or concerned. Okay, but your heart sounds great. You have a very regular rhythm. I'm sure if I hooked you up to an EKG, you'd be in normal sinus.
Awesome.
Okay, so now we're going to move on to your abdomen, and if it's okay, I'd like to lift up your shirt.
Mm-hmm.
Okay. So, as I can see from Luke's belly, that it appears to be non-distended and soft, and a nice flat tone to it, and an even skin tone that's appropriate for ethnicity. Okay, and so now that I've inspected, I'm going to go ahead and do some listening, okay? I'm going to listen to all 4 quadrants of Luke's belly, kind of around the umbilicus. And as expected for being later in the evening, I'm hearing more activity kind of on that left side as it's kind of moving towards his colon. And since we're talking about your colon, Luke, when was the last time that you pooped today?
4:58.
Oh my goodness. And everything was normal, expected about that?
Yep.
Okay. Any pain, diarrhea,
Nope.
discolorations?
Nope.
Okay. Good consistency.
Mm-hmm.
Fabulous. Thank you for telling me about that. It felt good. All right. And so I'm going to keep listening to your belly. But what I heard in those 4 quadrants was the peristalsis was nice and active. I had some intermittent gurgling going on, and it was appropriate about every 10 seconds or so. Okay, so now we're going to listen to the vascular aspects of your belly. And I may or may not hear something. I actually don't want to hear anything over your liver or your spleen. That could be a sense of like a friction rub, because that could be a sign of inflammation. You can see for your liver. And for your spleen. You've got lots of gurgles even up there, my friend. Okay, and now I'm going to be listening for bruits in your belly for your major arteries that are in your abdomen. And so we've got your aortic, just hearing a fine rushing sound, and I'm going to listen for your your renal, excuse me. And then the iliac. And then if I were to listen to the femoral, I would flip this to my bell and I would go down kind of in that inguinal area. Okay, thank you very much, Luke. So now I'm going to feel on your belly, okay? And it's important that you let me know if you feel any pain while I'm doing that, okay?
Okay.
All right. Just kind of doing some light touches at first, just feeling the kind of what's underneath, if I'm feeling any masses or nodules, and if the abdomen is soft. Okay, now I'm going to do a little bit of some harder presses, okay? Just relax your belly. Relax, relax. Breathe for me. Good job. Okay. Okay. And now I want you to take a nice deep breath for me. And let it out slowly. And what I could be feeling here are the kidneys. They don't appear to be palpable, which is totally fine. And then same thing again, I want you to do that nice deep breath for me. And slowly out. Excellent job, excellent job. Overall, I don't have any concerns for Luke's abdomen. All right, other than we need to get dinner soon. Okay, so now you can go ahead and sit up for me and then kind of kick your legs over the edge of the bed like you were. So what we're going to do now is I'm just going to do your overall skin, okay? And so I'm going to assess what's called skin turgor. So if I could see one side of the back of your hand, excellent. And so what I want is to see that elasticity and then that rebound, which is perfect and instantaneous. So your skin turgor was instantaneous and perfect, showing good hydration. You're going to do the same thing on your clavicle. Perfect, exactly the same. Okay, and so now I'm going to feel with the dorsal part of my hands, going to evenly feel that temperature that you have. Okay, and bilaterally it is even and warm. And if I could see both of your hands, I'm going to assess for your cap refill. Perfect little pinches. And it was less than 2 seconds, showing that we have adequate hydration and I'm not concerned for sepsis or having any cardiac deficits at this time. Our nail beds are nice and flat and even, and our nails are at that 160 or kind of flat angle, and I'm not seeing any clubbing. That could be a sign of persistent hypoxia. Okay, so now I'm going to go ahead and go to your feet. So if you kind of want to just reach up your leg for me, thank you. And we're going to do that same thing. Nice pinch. Good, that cap refill was instantaneous. Let's do it on the other side. Perfect, exactly what I wanted to see. Okay. So now what we're going to do, Luke, is we're going to do, I'm going to give you 2 of my fingers, and I want you to squeeze them as hard as you can. Okay, squeeze, 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 squeeze. Good job. And I want you to pull against me. Good job. And push me away. Push me away. Good job. That's great. Okay. And so those were our hand grips were bilateral and equal. I definitely think Luke is at a 5+. Maybe even some hypertrophy in these upper muscles, our biceps and triceps. Looking good. Okay, and so now if you want to go ahead and lay back down, we're going to do the rest of our assessment that way. Okay, Luke, so similar to what we just did with your hands, what I want you to do is I want you to push down with your feet like you're driving a car. Push, 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 push. Great job. And then pull up, pull up, pull up. Great. And now I want you to take this, this heel and put it to your knee and drag it down. Good job. And if you could do the same thing on the other side, that heel. Good job. Excellent coordination. And while I'm down here, I'm going to go ahead and assess my pulses. So I've got my dorsalis pedis. Feel for my tibial pulse. I like doing it this way. Yeah, perfect. And I'm not seeing any edema in the feet or the lower extremities. Nothing that's pitting. Our skin tone is nice and even, and my temperature is exactly as expected. Okay, a couple more pulses. We're going to go underneath your knees. Great job. And I could be assessing for femoral, but we don't need to do that. And then I want to make sure that your radial pulses, it's kind of silly that I ended with these, but that your radial pulse is good. So I'm doing my underneath. Excellent. Go ahead and kind of just so the camera can see. Perfect. And all pulses were 2+ with a very even regular rate. Again, I'm not having any concerns for a cardiac alteration with Luke at this time. So I'm just going to make sure that I got everything, and I think I did. I'm not seeing any edema. Luke appears to be a very healthy 27-year-old. Okay. That is my assessment. Thank you.